You can hear me now? Yes. Thank you so much. First, thank you to the organizers for this kind invitation. I'm a bit humbled. Even if I like economics, this is not what I do on a daily basis. And really to get the outcomes of this is a work that I really appreciate from all of you. So what I'm going to try to do is to give you a narrative. Thank you so much. To give you a narrative on what could be, what is, and what could be. I hope you bear with me that I can be a bit pushy, but I do push people with kindness, so with some elegance, I hope. I also think it's very good to see so many people and also salute you and congratulate on the huge work that has been done for so many years. But could it be different? Could it be better? That's what I'm going to try to take. I also have a big heart for Latin America. Así que, mis amigos de América Latina, gracias por recibirme aquí. Y bom dia, brasileiros. Hope you're well. Hope we can work a lot together. So the main focus that I really will push on here is imagination. You're used to hard science. I'm asking you for imagination. Be 3-year-old, accept that what if is a question. So at the moment, I'm leading the Movement Health Foundation that I helped initiate 5 years ago. 11 years before, I spent on building health at Copenhagen Institute for Future Studies, a lot with scenarios and horizon scannings and other things. The topic we are having on this year is really next-gen methods, global demand, hype, reality or fake or stay, and transparent and fair and equitable use on the methodology. And I think this is very good for a frame on what I've put on as well. And I'm really curious on that text there because it reveals if my English is good enough. So, opportunities and responsibilities. HTAi as a change maker. Leave your conservative thoughts for a moment. It's about the what and it's really about the how. So first I'm going to ask you a question. But observe something for 15 seconds first. So these are commercials from the early 1900s and mid-1900s. You could only be a good doctor if you smoked Camel. It was not enough to smoke. If you had toothache as a kid 100 years ago, you got cocaine. Must have been much more fun than today. And if you had asthma, you should just buy some cigarettes. So these today are absurd examples of the past. My question to you is, think, what are we doing today that our kids, our grandkids, and their kids, they will come back to us and say, what were you thinking? This is totally absurd. That is the exercise. Rethink those parts. Then I'm going to ask you a few questions, so this turned out a bit small. But we have dilemmas all the time. You work with dilemmas constantly. So for instance, on the digital health, so do we want minimal human interaction? Or do we really want to have tech or to have humans being the main delivery? So tech as a prime or tech as a support? So this is a question. You can only choose one of them because you have to decide the strategy. So who think that tech should actually be the main driver in our development? Raise your hand. Nobody. Okay. So we have a pure room of humanistic economists. That's good. I don't think I've ever tried that before. But it also comes into the how we apply data, and this is more directly to how you work, right? So what are we doing? Is data protection most important, or is the usability of the data most important? So, who thinks data protection is more important than usability? Huh? Oh, you are very different from normal audiences. Then the core part on, can I go back? On your question is the outcomes. So is it the outcomes for the society or is it the outcome for the individual? You have to choose. Society, that's what you do. Is that the more utilitarian? Okay, got you. So universal health coverage is for whom? The society or for the individual? I'm just joking. Don't take me seriously. Okay. The experiment here is what happens if we build health as the most important societal pillar. I'm not asking you to believe it. I'm asking you just to make the exercise. How would you prioritize if health really was the most important societal pillar? So this is for the benefit of patients, professionals, population, and planet. But this is also to build, most importantly, the dignity, equity, security, and prosperity. Yeah? We should also have in mind that we only understand the future if we look a bit at the past. Sorry about what happened there. But we need really to look at the past to understand. It's also, when we look at history, there are certain moments that make us change, make us realize that we can do things differently. And we are constrained by echoes of the past. So we heard earlier that we didn't take the opportunity of COVID. It was a huge opportunity for change. We didn't take it. Now we have a second opportunity. Did we learn? There is a new way of framing public health on a global level. So are we going to take that opportunity? So maybe the next 10 years will bring more than the last 100 years. And maybe the next 100 years bring more than the last 1,000,000 years. So that's what you need to relate to on an evidence-based approach. So if we look a little bit back, 1,000,000 years ago, we couldn't even speak. 100,000 years ago, we began to talk a little bit together. And 1,000 years ago, we began to think about, or we have the first thoughts, written thoughts about more systematic health in that part. But then if we jump forward to 100 years ago, we suddenly got an explosion with first insulin coming, if we take some parts on this. Then we get penicillin in the 30s. Vaccinations are coming in the 40s, right? We have the magnificent on polio vaccines from the 50s, birth pills in the 60s, and then suddenly we begin to accelerate with microprocessor MRIs and stuff like that in the 70s. In the 80s, robotic surgery is beginning slowly. And then my favorite, the genomics, is really starting in the 90s, right? So you can see, you can get a grasp of how fast this suddenly gets. And then we get the digitalization in the zeros, going in on CRISPR and AI, immunotherapies, wearables, 3D printing, and where are we now? Are we now bringing things together in a convergence of human and technology? We have had intelligent optimization for many years. AI is high on our agenda, but the next step is what we are beginning to call general artificial intelligence, which then can work much more independently. And we probably need to prepare for what that future is. So not just look at what we are seeing right now, but what is coming in that future. So really to be or not to be in this part. We also have a great misconception. We always hear that things have never been worse. Oh, better, sorry. Things have never been better. But there are a lot of things which have been improved a lot. So we can just take some examples. Our life expectancy has doubled the last 100 years, in almost all countries, more in many. And we have reduced disease burden, especially on communicable diseases, a lot. There are many successes that we should be very, very proud of. So how do we get these learnings back in? And how do we really think what is possible and move forward? And this is where I think you have a great opportunity. But still, we never had more money, we never had more persons in healthcare, we never had more knowledge, we never had more hospitals, computing power, and everything is on a burn down. We are burning out, we are breaking down, so what is really happening? So we have a growing disease burden, especially of the NCDs, which we can't really control. Health professionals are burning out. We have daily crisis mode. And we are getting sicker for many, many reasons, which are not inside the health system, but for many other reasons. So the crisis we have today is not lack of money. It's not lack of personnel. It's not lack of technology. It's a mindset. It's really rethinking, how do we go away from the reactive health system? How can we move with economic analysis, with technology, with really rethinking what could the future look like and go forward from there? So just an example from the European Union, 91% of the deaths and 87% of the dollars in the EU are NCDs. But we built our hospital thinking 100, 150 years ago to work with accidents, violence, and communicable diseases. Acute. We are still planning and working acute. We are still educating acute. Our challenge is not acute. Our challenge is to intervene early and precise, is to think public health. So how do we really change that way of reducing the disease burden? And you could say, this could make us all cry, and I think this is what we hear around everywhere. We are crying. But the reality is that tears don't change the world. Mindset do. So I urge you to stop crying and change your mind. The real question is, where do we go from here? So the only thing we have really learned from history is that it's the great shifts of mind that helps us to get to the next level. So just think about light. 150, 200, 300 years ago, you had candles. But we did not redevelop the candle to the light that we have in this room. There were changes of mind, so we need to take that in. Where we are today is that we have conceptually stepped into a third industrial revolution, and then we are in the fourth, where we really are building smart materials, genomics, data, digital functions in different ways. And we need to figure out what the fifth industrial revolution is. How do we work with that? And I will explain a bit more. Our biggest challenge is that we are all trained reductionistically. We are changed in technical changes are we trained in. So how do we work when we have a challenge? We sit down, we work reductionistically, and we figure out a problem in a very, how can I say, academic way. And that's very good when your box is right and you can do things better. But it doesn't help you enough if the challenge is bigger. If you really need to work a new way out on how to deal with things, that's what we call adaptive change. And adaptive change is more system thinking, but what happens is that you can convince grant givers, ministries that we should do adaptive change. Most people agree on it, but if they give you money, the toolbox is for technical change. It's a Gantt chart to really precisely say when to do what, and that doesn't work for adaptive change. So what we are dreaming about, we actually do not have the methodology to do. So that is also one of the huge tasks for a community like yours. So here the real question that we always ask when we push this mindset is, are we doing things right? You do a lot of things right. You could also do a lot of things a bit better. But are you doing the right things? And you need to get both those sides together at the same time. So how do we really rethink our health system from the late treatment regime that we are having today, which is not sustainable? We know it. I don't have to justify that, to our best health span, and maybe really starting with focusing on secondary prevention in that part. So the way we are thinking the fifth industrial revolution is to say, okay, we have the fourth industrial revolution, biology, genomics, different kinds of omics, data, digital, imaging, material that you can put together in different ways, but it has all been focused on quantities, volumes. How much could you put in? It was never focused on how much does this help the system or the person. So the fifth is actually a value approach. So how do you merge these kinds of technologies in a way that you actually get value for the society and for the person in it? So just to give you one example, on average, we use 3% of the health data we produce, 3%. Likely, in any given countries, you spend more money on hosting data you are not using than on rare disease. It's absurd, the way that we are doing that today. So, how do we rebuild with a purpose? And there are very simple ways to challenge yourself. We know that the future is exponential, so it has to be very different in it. But the reality is that if you don't know where you're going, any road takes you there. But it's not where you want to be. So how can we imagine and define where we really want to go? So again, this is really about changing our mind and changing our course. So what does it then mean if health was the most important societal pillar? It's really to drive equity, fairness, equality, but it's also about the country's safety, security, and resilience. So inner resilience in a country. It's about the sustainable growth and prosperity. It's also about applying the well-being economy. A reduction in the avoidable disease burden is a must, but the drivers probably also need to be dignity and solidarity. Our origin of health system from Bismarck many years ago was really risk-sharing and solidarity. Are we really focusing on keeping solidarity to the next level? I think that's one of our biggest challenges. But this could also be a huge part to push in for sustainability. Health, globally, is the 5th biggest polluter in the world. So how do you lower the carbon footprint? Less waste. Of course, if you decrease the disease burden, we do less, so that's good. But this is also really about building health as an investment. But if you want to realize that saying of building health as an investment, you need to provide value to society outside of the health sector. It's not enough that you only think about the health sector. So what is the value that you are providing to society? We do this a lot with building digital bridges. Not new buildings, not new staff, not new materials, building digital bridges between what exists. So you know this very well, that we normally, in countries, we only begin to pay when people are 80% very ill. You need to be entitled, sick enough to get treatment. With the knowledge that we have today, this is totally absurd. And this is where we really need economic estimations from persons like you to get in. And we also know, and this is very well documented in Denmark, that if you go in early and you can keep especially the chronic diseases at a low level, you delay the second chronic disease, the third chronic disease. We even have good data that shows that if you get disease A, you probably get disease B in 5 months. So can we prevent that? We have this knowledge, still we are not doing it. So how can we begin to think much more in those lines? And then we have worked quite a lot of what we label the concept of cost of inaction. So what are we paying in the future for things that we could have done but did not do? So it is a reversed opportunity cost, you could say. And we all know this, but the way health budgets are set up more often in yearly budgets makes it impossible to work. But we have so many good cases where this pays off. So hypertension, for instance, in India, with a huge saving. We have integrated disease management with COPD that I worked a lot with in Canada and the UK, where you can reduce the cost or reduce the admission to hospitals, so you actually reduce $10,000 cost for each admission. We know these things and still we are not applying. Also with weight management in England, both to keep them healthier but also to reduce the diabetes. And the Rwanda on the HPV vaccine, which has a huge potential or has a huge future reduction of cost going forward in these parts. And also US national diabetes prevention programs, which is very well documented on having a huge value. So this is really where we need to rethink and redefine value and money as a part of value. And this, I guess, is what you work with a lot. So, the most important question. Why are you here? Why do you wake up every morning? Why do you go to work? Is it to build the best health system in the world, or is it to have the healthiest population? Yeah, it's not the same thing. Of course, the reality is a mixture of both, but this is not the same thing. When I ask ministers about this, they always respond, of course, the healthiest population. And then I ask, of your decisions the last 6 months, how many of them were for the population and not for the system first? I'm still waiting for the first answer. So you could say that history really calls upon us. Is it the reactive sick care with the third and the fourth industrial revolution that we really want to make better? Is that our big ambition? Is that the learning we have from COVID and the breakdown of the international system now? Or is it a more proactive health span with the fifth industrial revolution mindset with the new technology? And you are the ones who will be building the frames for how do we make these technologies beneficial in that. And it requires a new thinking. And the building blocks of the future are many. I worked with some of these. One of the things that we did was in Nordic Health that we established in 2019, which took on the question on saying, okay, are we on a sustainable track here? No. Will the system break down in less than 10 years? Yes. We were estimated that 25% of the active workforce would be in social and healthcare inside the next 10 years if we did not change the way of working. And you cannot sustain that as a society. So the question here was that given that the Nordic countries use 10% of their GDP on the health budget, which in reality is 98% sick care, what if half of that went to preventative, primary, secondary, and tertiary prevention, and then you keep the half for the normal curative in order to begin to change that trajectory. So that's one of the mindsets that we have pushed a lot. And a very important part of doing that is that probably already today we have 90% of the knowledge and technology to do that change. So it's not just about inventing new things. It's really about looking what already exists and apply what we know works. Another part in this way of thinking is what was the P4 medicine from Leroy Hood, which came 25 years ago, but adding a potential in the middle. So not just being personalized, preventive, predictive, and participatory, but actually including the individual person to be a master of their own health. So one thing is the part of integrating and really being personalized. The other part is that we also need a data carrier for health data in the world. We're trying to build mastodon system that will fail, system after system. So why not just make the person a data carrier in that part? And we know that working this way will be cheaper, cleaner, smarter, but it requires that we think totally differently in data. So the first pillar that we built here was to say, okay, what happens, and this is from 2019, before ChatGPT and all of these things, and before COVID, what happens if you take the data that exists, no new data, you put it in the hands of the individual and help it with governance and AI models to live their life as they want in better ways. But they will also become real-time data producer by design. And of course, with AI, you can do a lot, and probably most of you use it for different ways, so we need to integrate that as well into it. But there is a bigger challenge, which we then tried to address really hard, which we call the sustainability model. So I worked a lot in personalized health, precision medicine, genomics, all of these things. Not a single of those projects focused on the person. It was always about a better system. Yeah, I think you can recognize that. So if we want to go forward, I'm not saying this is the right way, but if we want to go forward and have precise early detection, good intervention, learning longitudinal, we actually need real-time data. Static data is not good enough. there's only one person that can do that. That's you. It doesn't work any other way. So the challenge here is how do you build that? And how do you integrate that so you can make aggregated data with individual and feed it back? So secondary use of data is very good for research, for aggregated understanding, but it doesn't give you the precise intervention to the person. So that's also one of the ways that we have worked in many different initiatives. Should we trust AI blindly? Definitely not. But we have Bishop's and Childress principles of bioethical ethics, biomedical ethics, and if you add proportionality, we could probably use that. We also need to understand that protection with data is important. Of course, we need to protect from data, but we produce data to use data. Today, we are producing data to buy cybersecurity devices, which is quite insane. We should also apply that there should be a penalty of harming by not applying data that should be used. We are not doing that today. So the way we apply this is to say, okay, there are 5 categories with many different resolutions, technologies, mindsets around it. So improved technologies, what do we do with that? Improved prevention, how do we really go in and do prevention on the 3 levels mentioned? But we also need to be much better at the precise treatment and push that. To me, the most important thing is to define dignity and equity. Every time you do something, you need to ask, are you stripping dignity of people or are you improving that part? And of course, that goes into the sustainability part. Also, we should have in mind that you can actually frame the future. The future is not given. If you decide, and this is where imagination comes in, if you decide that you want to frame a certain way that you want the future, you actually need to make that plan. You need to define and describe what is it. What happens today is that we are all saying, this is not working well, I'm in a catastrophe, we have polar crisis, perma-crisis, and then I go to the decision makers and I ask them, okay, what do you want? What is the answer I get? More money. More money is not going to solve this. We really need to define what is it we want. So just to push it a little bit here, we know that we are getting very, very advanced new biologies in different levels with the genomics, omics, and all of those coming in. We have advanced digital functions. We will work with data in many, many different ways. We have smart materials that will be attached to things. And then also imaging technology is going to be here. These technologies are going to be merged. We are not going to work with just one source of information when we are going to do diagnosis in the future. We are going to merge these things in different ways. And this is where you will have a huge role as assessing how is this going to work. And just to give you a question, imagine that somebody grown up or old in the 30s walked in the hospital today. They would think they were transported to a different world, right? And this is probably what 10 years from now will look like. So you need to get that in your head when you plan what is the role of HTAi going forward. So it is really high-speed progress that is exponential. And maybe, as I said in the beginning, the next 10 years will bring more than the last 100 years that I showed, and the next 100 years will bring more than the last 1,000,000 years. So this is what we also need to plan for when we go forward. But the real question here is not if we can do something, is why we want to do something. What is the purpose? What is it we want to achieve? I do approach many of these things in several projects. For instance, respiratory health initiatives where we focused a lot on COPD, third biggest killer in the world, no attention. So to build an index on showing why this would be good. Gaia is an app for young mothers for Latin America to help them with information to be able to control pregnancy and not be pregnant again. Improve is on patient-reported outcome that Eva, who sits here, is also involved in. We also work in an SBI on strategic partnership with WHO together on defining best practices. My Health in My Hands is actually an EU project from the Commission that takes our humanome model into a European setting and makes it workable in that way. And then one fallout here is FH Europe, which Safina, that is somewhere around here, has done a very good work of the HTAi on defining on how we can work with that going forward and showing why that is a good way of testing and screening for Lp(a) in it. And then we are building a project with WHO Europe and Danish Life Science Cluster and my old Copenhagen Institute to fast track known projects that we then can implement in different ways. So sorry about the small text here, but core things to really think about here is the 5-5. Can we find a balance to work between curative and preventive? And that's also, I think, is a question for you today on how much are you focusing on demand and how much should you focus on actually framing, so not just listening to the demand. The 80-20, which I didn't really mention here, is that if you get the 5-5 right, and in any society you have at least 20% of the population that really needs deep health, you actually get more money for the 20% because you can keep the 80% healthier for longer. So this is also about prioritizing in that way. And then the biggest challenge for you guys, the 10-90. Everything that's being developed today is focused on the 10% richest in the world. How do we get models so we get the development to be much more focused on the other 90% so we get more global equity in that part? I know it's blinking, but I will finish now. These are projects that we are doing with Movement Health, a lot in Latin America. So very, very simple building bridges, really focusing on moving forward. But we are really also needing partners for health technology assessments and academy and developers in all of the countries. And then, what is it really we want to focus on? Is it to reduce the avoidable disease burden? Is that a goal with HTAi? And do we really want to push things so we can focus on helping the ones that need the most? And the last thing I want to say while this is playing is that I see the biggest opportunity in Latin America. In my continent, we have focused on very big hospitals, super hospitals, which are over expensive and not really providing the health outcomes that we need. But in Latin America, I see a huge focus on really advancing primary care. So if we can get a focus on primary care at the HTAi level and really making that work, Latin America could actually become the poster case on how we work in the future. So Brazil has a lot of inhabitants, so you can do scale there. The rest of Latin America is plus 500 million people that you can push with same digital interfaces around the world. So with that, I would say thank you and sorry for taking 1 minute extra of your time. I hope you forgive me. I guess that means that there are no questions.